No more silence, we'll raise our voice for every hero. We'll make the
Hi everybody, this is Todd Belknap, Executive Director of Veterans Helping Veterans USA, and once again, we're coming to you from our podcast studio here at Veterans United. Man behind the camera making all this happen is retired Navy veteran Brian Lang. We thank Brian for making all the magic happen today so we can bring to you more resources that are beneficial to the veteran community and beyond here in Marion County, Florida. Before we get started with our special guest today, I want to share with you something that is integral to the operation here at Veterans United and also at Veterans Helping Veterans USA. We are launching a grassroots initiative, a fundraising campaign, and it's called Mission 1776. And the purpose of Mission 1776 is to acknowledge the 250th anniversary of the United States of America while raising funds to help the growing number of at-risk and homeless veterans here in Marion County. How can you help? Great question. Glad you asked. How you can help is by donating $17.76 a month to this campaign, and you can do that on our pay portal on our website, but you'll be going to mission1776.org. That's mission1776.org. It lays out the program, the grassroots initiative, where your money's going, and how all of it, every penny, stays right here in Marion County. It doesn't go to Maine. It doesn't go to anywhere else. It stays right here to help the heroes in our midst. The good news, it's all tax deductible. You make a donation to us, it helps the veterans in need, and it also helps the community because a strong veteran community makes a stronger county. So thank you in advance for your anticipated support. We're looking for, Doc, I think we get 1,877 folks to donate $17.76 a month for 12 months. That's $400,000. We can help a lot of veterans with that kind of money. Again, we're a nonprofit. We're not affiliated with the VA or the county. We depend on grassroots donations from people like you, as well as grant initiatives to keep our doors open and where we can help our homeless and at-risk veterans go from surviving to thriving. So again, thank you for your support in this upcoming endeavor. So Dr. Joe Rosado is with us today, and Dr. Rosado is a primary care physician working in the medical cannabis and ketamine-assisted psychotherapy field. And I know absolutely nothing about either, which is why he's here. So,
that's not all true.
Well, I know a little bit.
That's not all true.
Statute of limitations is up. He just called me out here. Doc, tell us. First of all, welcome to the podcast. We are excited to hear what Dr. Rosado has to offer. So tell us.
First and foremost, it's a pleasure being here
Thank
and
you.
working with the veterans community that I've been doing for the past 10 years.
Yes.
I haven't been with this company, Doc MJ, for 10 years, but I have been with them going on 5
Yes.
this spring. So,
Yep. Thank you.
no, my pleasure.
Another ally to the veteran community right here.
Well, you guys definitely need it.
Well, yes.
I'm not one, but you guys definitely need it.
So tell us, how does this, the medical cannabis and the ketamine, I don't know if you want to separate the two or how, just tell us. A lot of people don't know about it, so let's educate our listeners and our viewers on what
Absolutely.
it's all about.
Well, first and foremost, people still don't know that medical cannabis is legal in the state of Florida.
Right.
There are rules and regulations in place. The whole movement began in 2014 when John Morgan started advertising for the decriminalization of medical cannabis in the state of Florida because of his strong ties with his little brother and his dad, who had some pretty serious ailments, conditions going on.
Sure.
And so he decided to take the bull by the horns and move the needle to decriminalize cannabis in the state of Florida.
Right.
Unfortunately, 2014, it didn't happen, but something did happen in June of 2014, and that's when they wrote a law, Senate Bill 1030, which allowed for the use of what's called low THC, or what most people refer to as CBD, the non-euphoric, or what doesn't make you high.
Okay.
And so that was in the books. It was called the Compassionate Care Act, but they only allowed cannabis for 4 diagnoses: One was cancer, the other was chronic conditions that cause seizures, the other was epilepsy, and the other was chronic conditions that caused muscle spasms. Okay? But again, just with low THC.
Right.
That was in the books, but guess what? There was no products. There were no dispensaries because the state still had not allowed that to occur.
Right.
But we had laws in the books. 2014 came, November, we were on the ballot. We missed it by less than 2 percentage points. We needed 60%. We got less than that. Back to the drawing board. 2016 came around. That's when a resounding 71% voted yes
That's
in
quite
favor.
a turnaround in 2 years.
2 years.
Wow.
Less
What
than
do you think- what do you-
60%.
And so, what do you attribute that turnaround to? Education, awareness.
More education, more awareness. The politicians worked their magic, worked the language around a little
Okay.
bit, and then it did pass.
Kind of tweak things a little
Yeah,
bit.
and so it passed in 2016. In June of 2016, they added to the Senate Bill 1030,
Okay.
which allowed for what's called the Right to Try Act, allowing the use of the whole plant, CBD with THC,
Okay.
for people that were terminally ill. And the state defined terminally ill as someone that if we did nothing for them, within 1 year, they would die.
Okay.
So that's
So
what
the end of life.
end of life.
Yeah.
And in March of 2016, my first cannabis patient came into my office in Volusia County. She was a 35-year-old female with an inoperable brain cancer that they had just removed as much as they could of the tumor in the front of her brain, but there was a portion of the tumor that could not be removed, and so they just decided, well, let's watch and wait.
Right.
And at that time, there were less than 30 certifying physicians for cannabis in the state of Florida, and I was one of them.
Okay.
She lived in Volusia County, and she went down the line and called 5 different offices. Mine was the 5th because we were listed in alphabetical order, and with my last name being R, always the last of the class. So, always. So when she went down, the first 4 were like, no, we're not doing that yet. We don't know what's happening. And I had already trained my staff. Anybody calls for this, you say yes. And so she did, they did, and she came into the office. And because at that time, the rule was you had to establish a doctor-patient relationship for 90 days prior to making a recommendation, even though we had no product, but I knew things were happening.
Sure. Going in the right direction.
Moving
Just
in the right direction.
Just not there yet.
And so she came in, we got her established, and then in August of 2016, she was the first in the greater Central Florida area to receive the low THC product, and then shortly thereafter, she was able to get the full cannabis product.
Okay.
That made it on all mainstream media, social media, etc. And so that got the word out that it was
exposure.
available. Then
So she was like the test tube baby for
exactly
things to come.
But it still wasn't technically legal in the state. The Amendment 2 still had not passed. We were working under the previous rules and regulations.
Okay.
Then 3 months later, the first child in the state of Florida received medical cannabis, who also was a patient of mine. He had a stage 4 aggressive head and neck tumor.
Oh boy.
And he was 15 years old. And the day after he received his medicine, and again, made the entire state's news, mainstream media, social media, the following day, this was a Monday, Tuesday was election day,
Right.
and it passed with a 71%.
Wow.
And so here he was, cutting edge.
Yep.
And so that kind of
timing was
dovetailed. The
impeccable
timing
there.
was amazing.
Yeah.
And so that's when the floodgates opened up.
Yep.
I got involved with a group called marijuanadoctors.com, which was really big in education and educating. I was their medical advisor, chief medical officer, and that's when it just snowballed.
Right.
Much has progressed since then, but as of right now, we do have a medical cannabis program. We have, if not 1 million, we have close to 1 million medical cannabis patients in the state. We have 2,500 physicians that are certified to recommend medical cannabis. I'm one of them, obviously. And so in 2021, I partnered with Doc MJ, and we've been offering medical cannabis services to everyone that qualifies. In the state of Florida, we have qualifying conditions,
Right.
Which the main one that we're going to be addressing here today, obviously, is PTSD.
Right.
And everybody, and I speak with veterans consistently. In fact, I was speaking with one just 2 days ago. Over the weekend, I was golfing, and there were some veterans there.
A
And
doctor who golfs, imagine that.
I know. No stereotypes here, except it wasn't a Wednesday. So
During working hours. I'm sorry. Go ahead.
So, but we were talking, and we were talking about the use of cannabis for PTSD, et cetera. And he said, "Well, I've not received that designation."
Right.
And he's like, "Because I don't want it on my record." And I said, "Well, why wouldn't you want it on your record?" He's like, "No, because it's a sign of weakness." And I'm like, "Wow."
Yeah.
Like, damn. It's like,
Yeah.
okay, but you live it and you hear
Yes.
it all the time.
Yeah. Well,
And-
let me interject here.
Yeah.
Veterans and first responders, I wore both of those hats, and Brian's already nodding his head yes. When you're on active duty and you have an ailment, you could have a severed artery or limb, and you will most of the time not go get it treated because some of your commanders look at you as a malingerer, or you're just getting out of training. So we have an old saying. Yeah, get shamed for it. So we have an old saying, I just rub dirt on it and change your socks and you'll be okay. So, and hydrate. Yeah, stay hydrated. Makes everything go away. So that's the sign of weakness that Doc heard there. So
Right. And so, but because I've had this conversation before,
Right.
I turned it around and said, PTSD is not weakness.
Amen.
It is a nervous system that is in a constant state of survival.
Yep.
People with PTSD consistently are in a state of fight or flight.
Yes.
And their brain doesn't know the difference whether they're still at war or not at war.
Yeah.
And that's what's being replayed. So you may have experienced an incident one time, but by you reliving it and replaying it multiple times, that is causing your brain to believe, because your subconscious brain doesn't know the difference whether
Right.
it's real or Memorex. Remember that commercial?
Yeah.
If it's
Is it live or Memorex? Yeah.
So is it real or not real?
Right.
And because you're playing it in your mind, it's real for you.
Yeah.
And so the main thing that we need to understand is accept that it is a medically qualifying condition.
Right.
It is a medical diagnosis. It is a legitimate medical diagnosis.
Yeah.
And in no way, shape, or form does it make you less than a veteran, make you less than a soldier, make you less than a Marine, because
Amen.
once a Marine, always a Marine.
Amen.
And so for that, that's what we're here for, to support and educate and let them know that, no, you're not going to be considered weak, but more importantly, you're not going to lose your benefits either, because that's another concern.
Yes. Yep. And understandably, and I think education and going back to awareness, which leads to education, which leads to converting people to, and I was one of them. I have never used it. But I do have a friend in Virginia, a war on terror veteran, who has a lot of demons. And he's a good man, good family man, good husband, good father. And not until he was introduced into the medical marijuana, it helped him tamp things down. It allowed him to, it didn't eradicate the problems. He still has his demons, but he knows how to manage them now. And he's not gumbied up. He's not drooling in a cup. He's functional.
Yeah.
As opposed to isolating. So because I knew him, I'm going to keep him nameless because he's going to be watching. He knew how he was, and he knows how he is now. And his family is so grateful for this medical marijuana, because he's not who he used to be before combat and everything, but he isn't who he was before he started
The cannabis. Exactly.
Yes. So, yeah.
And these are the stories that I see, over the past 10 years, 5 years independent, and then 5 years with Doc MJ. And so we offer cannabis, but the most important thing, as you stated, you're getting medicated. You're not being incapacitated.
Correct.
And the example that I give patients is, okay, you get a prescription for an opiate or narcotic.
Right.
Okay. you take that medication as your medicine for your pain.
Right.
Now, does that make you an addict? No. Does that make you dependent on that? Eventually, if you continue,
Right.
maybe. But at that moment, when you need it, and it's your medicine.
Right.
It's the same thing with the cannabis. Now, down the street, you may have somebody inject heroin in their arm.
Right.
They're related. Heroin is very similar to the opiates that are prescribed.
Right.
Nonetheless, it's a different outcome. That
Correct.
individual is using it to escape.
Right.
The other one is using it to medicate.
Right.
The cannabis is being used to medicate.
And so you can be a functioning person.
Exactly.
And so you can be somebody who's independent, return to your family life, your work life. You're not hibernating. You're not isolating. Boy, oh boy, we see so many veterans here, Dr. Rosado, who they come in the door and they're completely lost through no fault of their own. This is they when they went on active duty, they weren't like this. So something happened, whether they were in peacetime or combat, primarily combat. They know that they're never going to be restored to how they were. But when we introduce them to resources like yours, I'm going to give you one today. He was in our office today looking for the VA at 8 o'clock. That he came to the wrong building, but now he's happy he came here because he got some resources. Mm-hmm. So he's coming back at about 3 o'clock. Having you and the other resources that help tamp down a post-traumatic stress disorder is nothing short of a lifeline that is being thrown to veteran and first responder families. And it's not limited to that. Whoever suffers needlessly from PTSD, these resources are tremendous.
Yeah, because it's not only PTSD that we're working with. We have I mentioned two patients with cancer. That's a qualifying condition.
Yep.
Multiple sclerosis, Lou Gehrig's disease, ALS.
Yeah.
We have HIV, AIDS, Crohn's disease. So we have a vast array of conditions, but the state of Florida also threw us, the doctors, a lifeline, and that is any condition that's equal to or in greater severity than one of the named qualifying conditions will qualify you as well. So, for example, if somebody has insomnia, and says, no, I don't have any PTSD, I don't have any anxiety, but I have insomnia. Or I have depression. I don't have PTSD, but I have depression.
Right.
Or I have irritable bowel syndrome, I don't have Crohn's disease. Well,
Right.
we can put them in those umbrellas and
Right.
allow them to be able to get their medication.
Yeah, right.
So that's important. Now, you touched a great point on first responders. The challenge, being an ex-first responder myself, EMT and then paramedic, my lifeline has been quite varied, all in medicine, but from the age of 16, 1978, I started out as a certified nurse's aide and orderly, then became an EMT, then an EMT paramedic, then a cath lab technician, then was involved in a really bad car accident and decided to go to chiropractic school instead of medical school, was a chiropractor, got frustrated with the limited scope of practice, and then decided to go to medical school. And then after medical school, I went and got an MBA in healthcare management because I was a great doctor but didn't know crap about business.
Hey, you knew your limitations.
A man's got to know his limitations.
Clint Eastwood. Yeah, amen.
And so I came from that. So midway through my medical career, I was an EMT paramedic.
Right.
And back then, how did we deal with issues? Well, the way things were, the way we deal with things now as a first responder. We drink alcohol.
Yep.
Because it's legal. And so we were functional alcoholics. We would binge drink when we were not on duty, when we were not on shift, and when we were on shift, we were there.
Yeah.
Well, the challenge with cannabis is many jurisdictions, many municipalities do not allow for a first responder to have a medical cannabis card and be a medical cannabis patient. Right now, there is a case in the state of Florida where it's being challenged, but in general, that's the belief, that's the concept, which is why we've adopted an additional support for first responders with PTSD, and that is the use of ketamine-assisted psychotherapy.
Awesome. That's what I was just going to Perfect.
And so the issue with ketamine, because the minute you mention ketamine, they think, oh, that's horse tranquilizer. Being in Ocala, the horse capital of the world, although Saudi Arabia and Kentucky have a different perspective.
Yeah, they do.
But because we are in Ocala, and because of that familiarity,
Right.
people know that it used to be used as a horse tranquilizer. Well, it is also used in medicine. It's used for chronic pain.
Right.
It's been used as an anesthetic for short procedures. Well, studies have been done, and they found that at a low dose, it can be used to treat post-traumatic stress disorder, treatment-resistant depression, which is defined as anyone who has depression, has been diagnosed with depression, and has been on at least 2 different medications for their depression, and they
Okay.
continue to be depressed.
Right.
That qualifies them under treatment-resistant depression.
Okay.
And then lastly, suicidal ideation, suicidal thoughts. Well,
Okay.
we know that some say it's 22 veterans per day commit suicide.
Way higher.
You say it's closer to 40.
Yep.
Somewhere between 22 and 40, we have a problem, Houston.
Yeah.
So
Yep.
because of that, we've created this alternative, or in conjunction with, depending on the circumstance and the situation, where we will support them with this medication. And the benefit of this medication is that it allows for what's called neuroplasticity. Neuro meaning nerve, plasticity meaning regeneration of nerve cells. We were taught for years that once a brain cell is damaged, it's damaged forever. Well, new studies have shown that there are certain chemicals that occur in our bodies, in our brain, that will allow for the formation and the creation of brain cells. And that is where the ketamine comes into play, and it allows for individuals to replenish the brain cells that have been shed away because of the chronic depression, the chronic post-traumatic stress disorder. And it's not a medication that's tested on a urine drug screen.
Oh.
I'm a medical review officer.
Yeah.
And together with everything, it's one of the certifications I've received.
And all the spare time you don't have. right?
Exactly.
Yeah.
I'm the guy that calls you if you had a positive urine drug screen test and says, hey, you had a urine drug screen for XYZ reason and you came back positive for X.
Right.
Have you had a medical procedure? Are you on a medication, et cetera?
Right.
So, and knowing which medications make that list, ketamine is not one of them.
Okay.
Also, the half-life of ketamine is 3 hours. A ketamine session lasts about 2 hours, so by the time they're done and they go and pee, 85 to 90% of the medication is eliminated through urine. So it's out of the system within 24 hours. They're pretty clean and clear of that medication.
Okay.
But the changes that we've seen
Right.
are just absolutely amazing.
Awesome.
Absolutely amazing. And so we have a lot of veterans that have willingly stated, hey, if anybody wants to know about it,
Right.
give them my name, give them my phone
Yeah.
number, because I can sit here until I'm blue in the face and say, yeah, it works great, and show you tons of studies. Brian could pull up 30, 40 medical
Right.
journal articles refereed
Yes.
on the screen right now, but that doesn't mean
The
that
best word of mouth and personal
The
testimony
yeah.
is the best way. No different than, hey, this is a great restaurant, or hey, go see this movie. I don't give a what Siskel and Ebert say, but I know you. What do you think? And so that's, if I hear another veteran, which I go back to my friend in Virginia,
right?
he changed my viewpoint on it. Before I was, I saw my friend get his life back.
In the shadows of the night, they fought the fight. Brave hearts, lost souls, searching for the light. With every battle scar, they carry the weight. But we're to lift them up, it's never too late. No more silence, we'll raise our voice. For every hero, we'll make the choice. Together we'll stand, united and proud. feels long and hope is thin, we'll be their family. We'll let the healing begin. No more fighting alone. We'll walk side by side. With the strength of our hearts, we'll be their guide. Let the love ignite. Let compassion flow. With every story shared, together we'll grow. Unite.